Aloha and welcome to the Kapuna Network. My name is Jerry Correa. I'm the CEO at St. Francis Healthcare System, Hawaii. And I wanted to share with you some of the programs that we've been creating over the years. I wanted to take you back to the year 2013, where we decided to take a look at the 8-acre campus that we have up in Liliha. And we did a process of revisioning on the campus. It was previously a hospital with medical office buildings with approximately 40 different services associated with the hospital. The hospital no longer existed in 2013, and we went through the process of revisioning it and saying to ourselves, what do we want to do with 8 acres in downtown Honolulu up in Liliha? So what we did was we created a vision of having a skilled nursing facility, an assisted living facility, and various geriatric services. The hospital already had, when it was a hospital, it already had a cancer center, it had labs, it had dialysis, pharmacy, and so forth. So we wanted to create a one-stop shop for seniors. So we embarked on a visioning process, and by 2015, we created and renovated one of the buildings on the Liliha campus to be a skilled nursing facility. For those of you that don't know what a skilled nursing facility is, it's an inpatient rehabilitation facility. Where it's temporary, 30 days to 60 days, that you do your rehab in an inpatient facility setting, and then you can go home. So we created a skilled nursing facility. Today it's the villas, the Ching Villas at St. Francis, and it is run by Ohana Pacific Management. That was the first part of our restructuring and revisioning process of the campus. The second part was the assisted living. I can tell you that as of today, we just received our licensing for an assisted living, and we're going to be taking in tenants in early January of 2021. So that's an exciting part for us. When we were creating the concept of the skilled nursing and the assisted living, one of the things that we wanted to do was also renovate the courtyard. And the courtyard at the campus is made up of a whole bunch of things. It's got training centers for caregivers. It's got cooking demonstration classes for seniors and for caregivers. We also have an adult daycare. An adult daycare is a place where a senior can come while their caregiver goes to work or needs some type of rest and come back in the afternoon and pick up their loved ones. So our campus vision of a skilled nursing facility, a courtyard, an assisted living, and an adult daycare has just been completed. And today we're at the end of 2020, and we're excited that the vision of the campus has come together. What's very unique about the campus, there's other facilities out there that have skilled nursing, assisted living, and also independent living. What's unique about the St. Francis campus, and we call it the Kupuna Village, you may have heard that before. The reason that we think the campus is very different than others is because there's various services downstairs. Because it was a hospital, because the campus was a hospital, it had dialysis, a cancer center, a pharmacy, labs, x-ray, and neurology, all on campus. Now, with people living on campus, they can go downstairs to get their medication. They can walk downstairs to get their labs. They can walk downstairs to get dialysis treatment. And that's very unique. It's actually unique in the United States. And it wasn't by design. It was because it was a hospital before. And now it's a place where people can live and actually go downstairs to take care of themselves and pick up your meds or have your labs drawn and so forth. So we're very excited about it. One thing that I can tell you that is during the visioning process, it became very clear to St. Francis that the vision that we had for the campus was probably larger than we could handle on our own. And so what we did was we actually partnered with a lot of organizations. We've got organizations such as Hawaii Pacific Neuroscience on campus. We've got that specializes in dementia, Alzheimer's, Parkinson's, MS, stroke, all of the neurological chronic conditions that they're focused on. We felt that that was a really good fit on campus, especially for our kupuna. We also partnered with Yo and Maranaka to come in and do the labs and the imaging part of the campus. Clinical Labs is actually doing our labs. PharmaCare is our pharmacy partner. The Cancer Center of Hawaii is our cancer partner on campus. We see about 140 cancer patients a day. Fresenius Liberty Dialysis is our partner on campus. They see 300 dialysis patients a day. We embarked on creating Geriatric Services on the campus. And by doing that, we also invited seniors into our facility to take a look at what we were creating. And we asked the seniors, what do you think? We had about 40 seniors that came in, and we asked them, what do you think with the vision that we're creating for the campus? And a lot of the seniors, specifically in the Liliha area that we brought in, came in with their caregivers. They came in with their middle-aged caregivers, such as somebody at my age, coming in with my parents. Excuse me. And we started to see during this process of talking to the seniors and explaining to them what we're doing, we started to see the caregiver stress that was going on, because the seniors came in with their caregivers. And it wasn't to the point where the caregivers were saying, I need help, help me, St. Francis. It wasn't like that at all. We could see the stress that was happening with some of these caregivers and their families. A lot of these caregivers are in a sandwich situation where they've got families of their own that they're taking care of, and now I need to help mom or dad. And there was no hesitation about helping mom or dad, because in Hawaii, we take care of our families, and I get that. And I've seen my parents take care of my grandparents, so in turn, we're gonna take care of our parents, no questions asked. But it's a very stressful situation on the caregivers. When we saw that, we made a decision at St. Francis that we're gonna have services for the caregivers. We're going to have and focus on areas in which we can give the caregivers a break. We may create more adult daycares. We have 4 adult daycares now where the caregivers can drop their parents off and come by later after work, or give them a break, come by later and pick up mom or dad. So we're going to be focused on more adult daycares for that. We're also going to be creating programs for the caregivers. Today, we have, in 2019, we actually taught over 1,000 caregivers, and we had about 40 different classes in teaching caregivers how to do things better as a caregiver. We had classes on trust, wills, estate planning, classes on Social Security, classes on Medicare fraud, classes even to the point of how do I bathe my mom or my dad? How do I deal with caregiving for somebody that has Parkinson's, for example? We have been working with subject matter experts out in the community, bringing them in to the Kupuna Village, into the Caregiver Training Center, so that they can teach people in the community, caregivers in the community, how to do some of these subjects. Some people may take it for granted, but I can tell you that, for example, a 2-hour class on how to bathe your parent, it seems pretty trivial, but I actually took part in the training, and 90% of the classroom event was on how to maneuver the person in the bed and not hurt yourself, not hurt your back, how to change the bed sheet without taking the person off the bed because you may be taking care of somebody who's bedridden. So there was a lot of technique that was going on. It wasn't just about bathing the individual. We have been working with the caregivers from day one and asking them, what do you want to see next? So we've been listening to the caregiver population and going out and getting the subject matter expert and bringing them into the Kupuna village to do the training. A lot of volunteers that are doing this, and again, they're subject matter experts. When I talk about trust, wills, and estate planning, we're bringing in attorneys to do those classes. So it's been a pretty cool journey in creating a Kupuna village of geriatric services, or services for the seniors and services for the caregivers. And knowing that we're not experts in every field, it's been a pretty good journey in partnering with good people out in the community that have in turn come to St. Francis to teach, come to St. Francis on the campus to share their knowledge with the community. And so we made that decision a while back that we're going to partner. We're not experts at everything, but we'll find the expert in the field, and as long as they have the same DNA and the same heart as St. Francis, in that you give back to the community, I refer to them as partners. And so it's been a good journey. I wanted to share with you some of the things that we've been doing over the last 5 to 7 years. Our vision of the campus has been coming to light. I'm excited about it. In the future, we're going to continue to look for positive ways that we can help our senior population. During COVID, we did a quick pivot, looked at the community. Back in April, we got into food security. And we were asked by some community partners to see if we could help with meal delivery services. We did a quick pivot, leaned on some of our partners to expand our call center. We leaned on a partner to get drivers. That was Elite Parking. We asked Elite if they could help us with the food delivery. And we started at 600 meals a day during the first weeks of quarantine. Through partners, we were able to deliver 600 meals a day. And within 3 to 4 weeks, it was hitting 1,400 meals a day. And that was really, really exciting and really special. I personally went on some of the meal deliveries, and what I saw, and what is still happening today, is that it's opening up a whole bunch of opportunities to help our kupuna. Delivering a meal to somebody that needs a meal was one thing, but as we, for example, I delivered 19 meals today, and I can tell you that I've seen individuals that the meal may not be the only problem that's happening in the house. Some individuals have dementia. Some individuals need help with transportation. They need to see their doctor on Thursday, and they have no transportation. Everybody's different. Everybody has a different situation. But giving the meals and is fantastic. Seeing the kupuna and engaging with the kupuna for that social aspect has been rewarding for me. I can tell that I may be the only person that a kupuna is seeing that day. But talking to the seniors and figuring out what they need is something that has been rewarding for me because I get to pass them on to our care coordination network at St. Francis. It's called Franciscan Care Plus. And we have a team of individuals that can reach out to some of our kupuna and get a deeper dive into what the problems are, what's the needs. Some people need transportation, some people need medication, some people need more social service programs. And our Franciscan Care Plus and Care Coordination Network will help them get to the right place at the right time. So really excited about it. And today I just wanted to share with you some of the services that we have. And if you need St. Francis, please don't hesitate to call on St. Francis. Thank you.